Almost all of us have experienced the frustration of waiting hours in the waiting room for an appointment that only lasts 15 minutes. Now imagine living hours away from the nearest hospital or clinic. For many people living in rural and remote communities, this is the reality. Relying on public transportation, taking time off work, or even just getting to the doctor's office can feel like an impossible challenge. But what if healthcare came to you instead? As easy as opening an app on your phone. This is where telemedicine comes in. Telemedicine is the use of electronic information and communications technologies to provide and support healthcare when distance separates the participants. In other words, telemedicine allows patients to connect with doctors and healthcare professionals virtually through video calls, phone calls, or secure messaging. It eliminates the need for unnecessary travel and long wait times, making healthcare more accessible and efficient. In a post-COVID-19 world, telemedicine is not just a backup option, it's becoming an essential part of modern healthcare delivery. From virtual checkups with your family doctor to specialist consultations without long-distance travel, telemedicine is breaking barriers and bringing quality care to everyone, no matter where they live. Telemedicine has been around longer than most people realize, with early forms dating back to the 1950s. In those days, doctors used radios to provide remote medical advice to patients in isolated areas, such as ships at sea or rural communities with limited access to healthcare. Over the years, advancements in telecommunications, including telephone consultations and video conferencing, slowly expanded the role of telemedicine. However, for much of its existence, telemedicine remained an underutilized and understudied tool. Many healthcare providers and patients still relied on traditional in-person visits, and regulatory barriers further slowed its widespread adoption. That all changed in 2020 when the COVID-19 pandemic created an unprecedented demand for remote healthcare solutions. With hospitals overwhelmed, strict lockdowns in place, and patients hesitant to visit clinics in person, telemedicine rapidly shifted from a niche option to a necessity. Virtual consultations skyrocketed, and governments worldwide relaxed regulations to facilitate remote care. Insurance companies also expanded coverage for telehealth services, making them more financially viable for both patients and providers. Telemedicine is not just a tool for routine consultations. It has become a game changer in emergency care and complex medical procedures. Let's explore some telemedicine platforms and real-world case studies that highlight its impact. Platforms like Teladoc and Amwell have revolutionized healthcare accessibility, allowing patients to consult with specialists from anywhere. But telemedicine isn't just about convenience. It's saving lives in critical situations where immediate care was previously impossible. Let's take a look at a compelling case where telemedicine played a life-saving role. A 33-year-old man arrived at a small, rural hospital with a severe ankle fracture dislocation, experiencing intense pain and loss of circulation to his foot. Immediate intervention was crucial, but the local medical staff lacked experience in performing procedural sedation and joint reduction. This is where telemedicine made the difference. With transportation delays preventing immediate transfer, a telehealth specialist stepped in, assuming leadership of the case remotely. Through video guidance, they coached the local team through ketamine sedation and an emergent joint reduction. The result? A successful procedure with immediate improvement in the patient's limb circulation, preventing long-term complications. Key lessons include selecting an appropriate anesthetic based on local experience, using a dedicated telehealth clinician to monitor vitals, and ensuring through pre-procedure discussions to optimize success. As telemedicine continues to evolve, its applications go beyond simple consultations. From emergency interventions to complex procedures, it's reshaping how and where critical care can be delivered, and this is just the beginning. The use of telemedicine has expanded significantly, especially after the COVID-19 pandemic. But what does the future hold for its use in rural areas? A major shift will be the integration of artificial intelligence to assist in diagnostics. A study in South Korea compared the ability of AI and radiologists to detect breast cancer mammograms. The results show that AI had a 90% detection rate, outperforming radiologists who had a 78% success rate. The ability for AI to analyze medical images and help doctors in diagnosing conditions remotely reduces the need for in-person visits. Incredible, right? Additionally, AI can monitor physiological metrics via wearable and implantable sensors, such as cardiovascular metrics, temperature, hydration, glucose levels, muscle tissue activity, and Parkinson's tremors. Remarkably, AI can also collect this data and transfer it to physicians. AI assistants can triage patients, help them understand the severity of their symptoms, and guide them on the next steps of their care. These capabilities bridge healthcare gaps in rural areas by enabling remote monitoring and ensuring timely medical attention, despite limited local resources. With the societal changes that occurred due to the pandemic, AI has also been able to provide mental health support, specifically cognitive behavioral therapy. These programs help to replicate in-person appointments, enable patients to access support at any time, and decrease the need for in-person visits, providing useful for those in rural areas. Though telemedicine has many benefits, there are areas of improvement. For example, a case study looking at the feasibility of conducting telerehabilitation in stroke patients living in the rural areas found that it's only practical under certain circumstances, because it requires the training of caregivers, increasing dependence on other people, and providing as an area of further improvement. Additionally, it has been found that patients who are older, non-white, live in a rural area, or are from lower socioeconomic groups continue to utilize telemedicine at lower rates. Future research must be done to investigate the barrier of technological access. It's also important to note that telemedicine cannot completely replace human interactions in healthcare, but must be used supplementary to in-person care. Telemedicine is transforming the way we see healthcare, making it faster, easier, and more convenient than ever before. As these technologies evolve, telemedicine will continue breaking barriers, making healthcare more personalized, accessible, and efficient. The future of medicine is digital, and it's closer than we think. Thank you for listening. In this video, we talked about what telemedicine is, the history of telemedicine, detailed case studies, and its future implications.